This is a great facility. Thank you for inviting us here. It's the first time the group from here has been to our facility in San Antonio several times, and we've done some projects together. This is my first time to come here, and it's just beautiful. You guys have done a great job. I'm going to take some. I took a lot of pictures. We're going to go get a couple of these phone booths. I love that. I think that's a great idea. But we're here today to talk about social determinants of health. And we're super excited. I'm CEO of Texas Research and Technology Foundation, which is an economic development-based foundation that was started in the mid-'80s. And one of our subsidiaries that we started investing in about 5 years ago is called Velocity Texas. And Velocity is an incubator accelerator for early stage companies, primarily focused in the health sciences. And so we do a lot of, we have about 28 companies that are in our facility growing. We have lots of programming, and then we also have a lot that just come in on an as-needed basis, or if they're in a surge of some sort, they'll come in and just take a seat anywhere in the organization and use our services. So we were very excited as part of the build-up to get with Methodist Ministries to talk about social determinants of health and advance the awareness, research, and innovation related to these determinants. So social determinants of health, or SDOH, are non-medical factors that influence health outcomes. Studies suggest that SDOH account for between 30 and 55% of health outcomes. And it's a broad subject, but we're going to try to narrow it today in the things that we're focused on within this agreement we did. So the partnership is particularly mission-aligned with Methodist Healthcare Ministries to improve the wellness of the least served. TRTF is currently working to establish an innovation district. I didn't know I had my picture. So this is where we are in San Antonio. If you can tell, we're just east of downtown. That's 281. Left to right is south to north. So we're on the east side of it, and we own this block where you see the colored roofs. Velocity Accelerator is in the middle of that block, and then and that's where we'll be overseeing the execution of 10 educational sessions designed to highlight the role of social determinants of health and how they play in shaping our community health program. These sessions will seek to raise awareness of social determinants among students, researchers, entrepreneurs, healthcare professionals, and the general population. The sessions will be hosted live at the University of Texas, Rio Grande Valley, and will be live streamed for remote access. So the accelerator, as I said, will be held at Velocity, and will administer a specialized accelerator tailored to startups that are working to address these issues. Velocity will leverage its bioscience experience, expertise to source leading companies from across the country, and the cohort-based program will provide growing companies with the assistance they need to best overcome the valley of death that frequently causes companies to fail. Programming modeled after gold standards of the industry will include a structured curriculum, mentoring, business coaching, operational advice, pitch development, and peer collaboration. Applications open in January, and the program begins in the fall of '24. So all of this is part of what we are building out in San Antonio is a innovation district focused on science and technology. This is the first block that we started with, and you'll see on this slide to the right is that first block. We've purchased an additional 2 blocks to expand this, and our plan is to build out about 700,000 square feet of space for research, commercialization, and related activities. So this is a picture of the entrance to our accelerator, where we do pitch training, we do a lot of mentoring, we also have Alamo Angels in there, which is an independent investor group that we do. When we take these companies and they get to a point where they're ready to be invested in and to move forward, we then take them into the Alamo Angels piece and we get them funded. So a lot of networking opportunity, a lot of opportunity if you have ideas built around the social determinants and how you're going to affect that continuum. We'd love to work with you. We'd love to help get you where you need to go. Thank you. And with that, I'll introduce Jennifer.
Good morning. How's everybody? Yeah? Yeah? Good? Okay. Quiet? Coffee? Pastries? Yes? So I want to start by saying that buenos días. Me disculpo por no hablar español. My deepest apologies. My name is Jennifer Knowlton. I am the Vice President for Community Health and Wellness at Methodist Healthcare Ministries. Methodist Healthcare Ministries is a faith-based nonprofit. Let's get this photo off the... There, that's much better. Methodist Healthcare Ministries is a faith-based nonprofit. We're based in San Antonio. We are an active half owner of the Methodist healthcare system in San Antonio. It's a unique partnership with HCA. We use the distributions from that ownership to fulfill our vision of improving the health of the least served. The conference of the United Methodist Church that first created the charter for the very first Methodist hospital in San Antonio is a conference of the United Methodist Church that encompasses 74 counties, including the Rio Grande Valley. So we consider the Rio Grande Valley part of our community, part of our neighborhood. Methodist Healthcare Ministries continues to honor that conference by encompassing this large 74-county footprint. We do that with intention and with honor. We have a long relationship with partners in the Rio Grande Valley. We have faith community nurses that we call Wesley nurses that are here in the Rio Grande Valley. We have community-based counselors, and we have a number of funded partners that we are in relationship with throughout all 4 counties of the Rio Grande Valley. So, Randy spoke a little bit about the social determinants of health. One of the things that we've learned along our 28-year journey as an organization is that health is impacted by more than access to care. So I'm using a visualization here developed by the School of Public Health at the University of Wisconsin, funded by the Robert Wood Johnson Foundation. And it highlights the impact of all of the different factors that impact health. You can see that access to care is only 20% of what impacts a person's and a community's health. The other 80% are impacted by health behaviors, the physical environment, and social and economic factors. Methodist Healthcare Ministries understands that this impacts not only the length of someone's life, but also the quality of their life. You may have heard some commercials on TV that talk about your zip code impacts your health. That is exactly what we're talking about here. These, in order to fulfill our vision, we have to connect with factors outside of just access to care. We recognize that we have to be in community. Methodist Healthcare Ministries is in fact working to broaden the definition of health care. All of us are impacted by these different factors. Our education level, our employment, our income, those determine if we have access to safe and affordable housing, if we can afford to live in a physical environment that has green space and safe walking spaces. It determines if we have access to transportation. All of us are impacted by these factors. However, our organization is focused on those for whom those factors create inequities. Our strategy that we created in 2019 focuses on achieving health equity. We want to create a community where all can thrive. The structure of our communities must change in order to create a place where all can thrive. I'm a visual learner. This is a visual example of a number of people that are trying to cross the street, but because of the differences in their health, and well-being and just physical stature, three of them are facing a barrier. When we achieve health equity, we create the environment, the community, the way that everybody has the same chance to cross the street and thrive. This is going to require us to think about health in different ways, and it's going to require all of us to think about unique partnerships to change the way we work, to be innovative, and to create unique partnerships to work together to create a community where all can thrive. Methodist Healthcare Ministries is honored to be a partner in this work, and please join me in welcoming your speaker for today, Matt Duke.
Clicker's up there. For the third time, good morning. It is still morning, right? Well, my name is Matthew Duke. I am with the South Texas Business Lawyers, and you may be saying, why is a lawyer here? I'll get to it in just a second. Which one is the clicker here? Oh, see, like for me, I think that's a detonator that I'm about to just destroy something. I'm like, well, it is a little bit of exciting to hit the green button. Okay, we'll get through that one really fast. But let me we're going to talk today about innovation, which is a journey. But before we do, let me just back up and tell you why there's a lawyer that's standing here in front of you. So I'm not your typical lawyer. I knew I hit the wrong button, see? I know. My journey actually started off as a lawyer, but then took a detour to a place that had deep impact on me. I became a part of Methodist Healthcare System, which is the largest healthcare system in South Texas. I joined as a lawyer and worked for Mr. Jamie Wazlowski, who was at the time the CEO of Methodist Healthcare System. Under his leadership as our CEO, I got to be a part of innovation. And that innovation at the care level, I saw the dramatic impact that it had on changing lives almost instantly. Within the four walls of our hospitals. Through that, I became the Senior Vice President of Operations, overseeing just about every single specialty you can think of, from oncology, orthopedics, cardiology, even hospital-based services. And again, the focus on innovation and what I got to be a part of by building partnerships with doctors, patients, community groups, third parties to deliver amazing, exceptional medical care was something that forever changed my life. But also one of the things that impacted me when I was there as an executive at the hospital was the surprise that when people left the four walls of our hospitals, sometimes and many times things changed for them. And so that was always something that I couldn't deal with because I was an executive at a healthcare system. When I decided to go back out into my own law firm back in 2020, I decided that was something that I wanted to see if I could have some sort of impact on. Through all that, my boss at the time retired for, I think, one day and became the CEO of Methodist Healthcare Ministries. Now, one of the things you may not know is Methodist Healthcare Ministries is half owner of Methodist Healthcare System. It's a beautiful, innovative partnership that was created along with HCA. But through that dialogue, we started talking about what could be done within our community to spur innovation. The same innovation that we were doing within the four walls of the hospital, is there a way to do that outside of those four walls, not necessarily through nonprofits, but through a for-profit model? through lots of discussions and partnership with Velocity Texas, which brings so much skill and expertise to innovation acceleration. That's why we're here today, is because of a vision that two individuals had and brought others along on the vision to try to do something innovative. So today what we're going to talk about is how you can start to look at innovation within your own community. And we're going to talk in terms of general innovation, but I'm going to offer you a model today to start thinking about it from the terms of how can you impact your community by impacting the social determinants of health. So we'll start with just a basic framework of what is innovation. Innovation is the process of creating something new. Now, that doesn't mean it has to be brand new. I saw a great picture of Elon Musk, some mural, which we're going to go take a selfie by before we leave. He's going in a spaceship to Mars eventually. Well, that's not anything new, but it's the way about where he's going to that makes it innovative and things that he's doing. So innovation is maybe creating a whole new process, a whole new product, figuring out how to have better inputs as to what's going into an existing product or entering into new markets. That's what innovation is. I would tell you that a lot of times we talk about entrepreneurs. I don't actually think they're the same. Innovation versus entrepreneurship. Entrepreneurship is more of the execution of building a business, the sales, the marketing. If you look at, the history of things, major changes in our world like Apple, there was visionaries and then there were those that could execute. Same with Microsoft. So I think these two things can be embodied in one person, but not necessarily the same. But we're just going to talk today about the beginnings of innovation. I'm a process guy. As I just told you, I ended up being at a decade with Methodist Healthcare System where we're all about process, because process was repetitive, process had control, process allows you to have certain expected outcomes, which we wanted exceptional care. And so we always talked about inputs, process, and outputs. And innovations, again, can actually be at all three of these different types of a traditional process. You could be improving a process, a new process, a piece of a process, taking your process to a new market. This is what I would just submit to you as an oversimplified way to think about innovation with regard to just a traditional process. And we already talked about this. But what if we were to think about this sort of process with regard to our own communities and the social determinants of health? What if we were to layer on to say, instead of inputs, process, and outputs, the process of life is what we would take a look at. An individual's life, a community's life, a nation's life. And what are the inputs into that person's life? Well, as you saw earlier, there's lots of factors, and we're going to talk about some more of the social determinants of health. The truth is, it could make up to almost 80% of the inputs that go into what is our life and the process of our life, which the output is the quality of our health, which you've already seen today. But part of it, and as you already heard, is 20% medical care. And many of the people that I talk to, when I talk about how do we improve the health, which is the output of life, they want to talk about medical access. They want to talk about medical devices, which are fantastic. Again, I saw these innovations on a daily basis being put out in, cardiology, just changing people's lives with things like the Watchmen that were able to go out there and have people do amazing things. But that's only 20% of really which can be the factor of an output of one's actual health that's out there. And so maybe thinking about it this way helps us to look at innovation. Now, the social determinants of health, this is in truth a really big area. If you look at it, we've got housing, food, education, transportation, social support, employment, health behaviors. There's not a whole lot of things out there that doesn't encompass one of these factors. And I'm not advocating today that there is one factor that is more important than the other. The issue is, can you use traditional innovation to identify problems in any of those factors, provide innovative solutions that are cost effective, and then deploy those and scale those across the community, across the state, across the country to actually make companies that are not only doing good, but doing well for their shareholders, for the community, for everyone that's out there. Now, this was from the American Hospital Association, and again, I am kind of a hospital guy in a former life, but I thought this was an interesting way to look at, the entirety of the impact of social determinants of health. Again, only 20% being access to care, quality of care, 30% being health behaviors. We've seen lots of innovations with regard to smoking cessation, which we know has a major impact in someone's life. We have a lot of conversations around alcohol, fentanyl and other sort of drugs that are permeating in our communities. These are behaviors that have a major effect on an individual and on a community. And then there are also things like someone's, mental health, which is a major epidemic that we don't talk enough about, to be honest. Each of these factors, I'm sure many of the people in these rooms can think about an innovation that could have an impact. And if we can find a way to start to grow those innovations, which is why the partnership between Methodist Healthcare Ministries and Velocity was put together, we can actually start to affect change, real change that is quality of life for our neighbors and for our communities that are out there. And then I hit the red button. It doesn't do anything, by the way. Again, this was also something that was already up, but I use this a lot as well in looking at it, is just looking at the percentages of stuff. But I would also submit to you that even though there are percentages on here with regard to which of the social determinants of health, are social and economic, the fact of the matter is we need to get going. We need to get innovative. We need to start pushing forward on incremental change, because with those incremental changes, we can see significant changes. So what I just want to start a conversation today about is the process of innovation, of where do you get innovation from? How can you start to build on an innovation, which really is just starting with an idea. And from that idea, building that into something that is tangible. And then from that building of something that is tangible, moving that into a company. And then next thing you know, you're an entrepreneur trying to grow that innovation across the community. I'm going to start out by looking at another model to look at, but let's talk about how do you come up with ideas. Now, one of the reasons we talked about having this partnership between Velocity and Methodist Healthcare Ministries brought into the Valley, talked about in San Antonio, is the sources of innovation typically come from those areas that are closest to the problem. That's typically the solution, is sitting around with the people that are experiencing the problem on a day-to-day basis. They just need the tools, they need the empowerment, they need the support to take the solution that they see that could be plugged into whatever it is, the problem that they see, and guide it along on that journey to create that innovation. But it starts with identifying the problem. You may know the problem, you may experience the problem. What is the problem? Now, there's a lot of ways to look at that. Root cause analysis. This really isn't an education lecture. It's just a beginning of a conversation for innovation. But digging down into not just what you see on the outside layer, but can you dig down into what the root cause is? Whether it's mental health, clean water, education, lack of accessibility to broadband, to internet. These are still symptomatics of a root cause that still needs to be drilled down into. And identifying that very specific problem is on the first way of creating that innovation or that idea for the innovation. Research is always helpful. In my life, today, I'm a business transactional lawyer. I deal with startups. I deal with small, medium-sized businesses across South Texas, including here down in the RGV. And a lot of times, the situations that I find business owners, entrepreneurs, innovators in, while they're unique, whatever facts are, their situation is typical to others. And so researching solutions, researching what the problem is, you'd be surprised when you start talking around that a lot of people know a lot. They just don't have a way to talk about it. So researching with others, of course, researching through experts is something that you can also do as well. And then reflecting on it. I've got friends all the time that constantly keep the notepad around and are just writing up ideas. I love it most of the time. They'll just start flipping through the book and tell you those ideas that they saw of, I've got this unique idea for a seatbelt for a toddler based upon, what I had with my kids. That is something that I don't think gets enough within these sort of community, social determinants of health issues. Is, are we really trying to think about solutions, or are we just experiencing the problems at all? And how are we maybe brainstorming ideas? How do you do that? Maybe something to help as well. And then ideating solutions. Once you identify the problem, even if you have your solution, I would say reverse, go back to drilling down what the problem is, because it will refine it. And then using tools like brainstorming, those sort of things to mind map out what you're trying to do as a solution is the beginning of trying to put together what is your innovation at a very, very high level. And, again, I've got friends, I've got clients that, they do this all the time. And I would just say that it's a good habit as an innovator to do. I mean, if you look at Leonardo da Vinci, we still marvel at his sketchbook of all the different things that he had. So, again, an iterative process for doing that, I think is something that's very helpful with regard to ideate. Now, once you start to dive into potential ideas, this is called a lean canvas, and this is an example of a lean canvas. If you Google lean canvas, you can find them everywhere. I actually office out of the Geekdom offices. They've got a big old whiteboard one that's sitting there. This exercise is something that is helpful to see if you can validate that idea, which is the second part of innovation. Because Leonardo da Vinci had a lot of good ideas too, and some of them just weren't practical, right? Which is why they just stayed on paper. This starts to take a lot of the research you've already done, that what is the problem, what is my solution, and starts to help you systematically work through, is this a valid potential company that we could create? Is this something we could validate? Now, this is for non-social determinants of health. But I'd like to talk really about one that we could modify that could take those same principles and take it one more level to help us evaluate the impact on our community. And so what I'd like to do is just walk through this lean canvas with you, and this is one that we've altered on our own. And, it'll go through cycles of improvement with us as well. And so if in the upper, I guess it's your right, it's your left-hand box from where you look at, is determining what is the social determinant of health factor that you are seeking. And you may say, well, that one should be pretty easy. What I have learned in having these conversations is, for these type of innovations, the common investor that's dealing with a lot of for-profit tech medical device, they don't really understand if you are on a mission to change your community unless you can really make it simple for them. So let's say that you're doing something that looks at mental health, which I think there's a lot of innovation in this. I think it's needed in our community, putting that there. The next one is, what's your problem? And you'll notice this is not a very big piece of paper. In fact, we'll probably shift it around to make it even, as we use this tool more and more. But the reason is, it's to try to get it so you can be succinct and very direct of what your innovation is. So what is your problem statement? Which is why that's what I focused a lot of time on, is really dig down into the root cause of what it is. Existing alternatives. My kids are around entrepreneurism, innovation all the time, and they come up with ideas as well, and then they'll Google and go, oh, somebody's already doing it. And I was like, well, kids, there was something called America Online when I was a kid, and it's not around anymore, and now you use Google all the time. So just because there's an alternative out there doesn't mean that it's not a good idea. In fact, it could actually validate your idea. Or it may be an alternative that is something that sets you apart, differentiates you, and makes you even better than your alternative. So alternatives don't have to be the same. They can actually be similar, but you can actually have a competitive advantage if you are slightly different. But get it on paper. It helps you to understand the strength of what you're looking to do. The solution, a succinct statement of solution is one of the hardest things in the world. The second thing is a pitch deck. And if you haven't done a pitch deck before, which I have for real, it's one of the hardest things where you talk about an innovation that you're passionate about, that you know everything about. You could talk to it for 5 hours about, but they give you 3 minutes. That's what this tool is to start driving down to be able to get very finite as to what is your solution, your unique value proposition. This is something I see in companies that clearly define themselves as trying to change the community, but have a nonprofit mentality, which is not what we're looking here for. We're looking to say, what are innovations that can be self-sustaining, that can change the communities, but also grow to be self-sustaining? This is not what would be a good nonprofit. And you need a unique value proposition. Why would somebody want to engage in your product or service or whatever your solution is? What makes you different? Why would they do that? And again, we give a little, section to talk about what that high-level concept is. The next thing, and again, this goes back to this nonprofit versus for-profit mentality, which we believe you can do good, but also be for-profit, is what's the revenue stream? For innovations early on, the reality is that there is no revenue stream. But you need to start thinking about, for any innovation, and this tool helps you do that, is how are you going to make money? If your make money is to receive a grant, and that's your sole source of revenue, that doesn't mean this isn't a good innovation. It just means you're looking at a nonprofit model, which needs, grants, donations in order to be successful. Those, we believe, are great. They are necessary for the community, and many, many people, including Methodist Healthcare Ministries, are on a mission to support that. But are there innovations out there that can be self-sustaining by having revenue they can generate on their own? And so this part of it is something to really spark the thought of, how could your innovation be self-sustaining? Even though on a startup, it's going to take investor money that's going to come in. Maybe there's, development costs. There's going to be some startup costs, of course. But how could this actually be something that goes out into the community? And then as we move down into the bottom parts, we see, key metrics. This is something through our education series we'll talk about. Many investors, many companies that I talk to that are actually in the social determinants of health space, they talk about the problem for entrepreneurs to be able to articulate how specifically they can judge success on impacting a factor. And so KPIs, or key performance metrics, whatever you want to call them, we talk about them with regard to revenue or process metrics that we can look at. But there needs to be, at the beginning, of how are we going to have a success statement of what we know success looks like for impacting that social determinant of health. What is that measure that I can have that I can numerically, quantitatively, not qualitatively, state that I'm on the road to meeting that success statement? But we also need to make sure that we have our traditional KPIs, which matter for our organization as well, so we actually have boxes for both. And then there's always the cost structure. Again, many of this tool is to seek validation for your innovation, this idea that you have, and sometimes the cost and the revenue stream just don't work. But thinking about that early on will help to then see if you can validate that innovative idea that you have as well. So, tool that keeps on getting improved for us there. And so after we go through an innovation, the process becomes, and we're not going to go in this today because we only get like 20 minutes to talk about this, is then taking that lean canvas, that well-developed now business plan, getting validation from others, and then if that looks like it's been validated, then the next step is moving to what we call an MVP, or a minimally viable product. And this is something where we take a process of creating a prototype or doing a test service or doing the bare bones necessary to try to create a model that will show our service, and then moving through deploying it, measuring it, analyzing that, improving that, and moving that process around. But it all stems all the way back from what is your innovation, and taking the time to really dig down into what is it that you're trying to solve, what is your vision, what are you trying to achieve. Now, I've dealt with a lot of entrepreneurs and startups through across a variety of industries, and a lot of people jump straight to just building the product. And I will tell you that in building a product from a funding standpoint, they usually start with their own money, or they go to friends and family. And many times there is a product that is created that hasn't had an actual innovation that's been validated. And so we won't move past this point today, but I would just encourage you to take that step back for any innovation that you have. If you're in the social determinants of health, use that tool or a tool like that to make sure you actually are making the impact. If you're not, if you're in innovation, just in general, use the lean canvas and take the time. Talk with others and say, look, do you have feedback? What do you think about this solution? What's my cost structure? Do you think it's reasonable what I have? Is my revenue stream something that is achievable? And get the feedback before you move on to just going forward with trying to create an MVP, because many of the startups that I see skip that part, jump right in, and then when the money runs out, or they realize they went, about this direction about 3 o'clock when they should have gone 9 o'clock, and they still could get there, but they're out of money, they're usually dead in the water. So this is an exciting thing. I'm so excited that y'all are here to join us. I know we'll be having more education as we dig deeper into innovations. But hopefully this has been informative. And I'll leave on the screen just if you want to take a picture. Actually, I don't know how to go back. Oh, that's how you go back. So that way, if you wanted to take a copy of this, what we would say is a social determinants of health lean canvas tool to help you in your journey, hopefully that provides value to you. Thank you. I'm supposed to hand this to, if anybody.
I don't know, does anybody have any questions for any of us? Well, we'll be here after.
Sure.
I was listening, I'm just a reporter.
Oh, you're just a reporter.
I'm just
a lawyer, so we're good.
But it appears to me, and I might be wrong, like this would apply to any business that's considering innovation.
In most businesses, there is an impact of community, correct? I mean, look what the internet did. It changed everyone's life as we know it. I mean, FaceTime, it is provided for, us during COVID to actually keep community when we can't be together. So innovation has changed. This tool, though, and our conversation is purposeful innovation to purposefully impact the social determinants of health right from the beginning of the creation of the innovation. So it's a slight twist to someone that happens to impact the community versus taking a purposeful impact of the community.
But your question is correct. It can apply to anything.
Yeah,
When we look at whether it's social determinants of health or somebody has a new vision, and they want to put out there the same process, the same validation. See, I thought I talked louder.
Sorry, sir. Yeah, no, it's really black, so that's why.
Oh, that's right.
I need to get your picture.
So yeah, I mean, this is any idea. We go through that stage of, has it got a good value proposition? Can you make it at a price that you can make it a profit? Do you know who your market is? What other stuff's out there in this market? Are you going to be disruptive? All those, it doesn't matter what you're talking about. And as it applies to social determinants of health, it's really important because there's a lot of different ways we can go. And focusing in on one and doing it really well, I think is what we're looking for.
I have a question. Is there any success stories that you would want to share with all of us that have used this example that have been successful? Or not successful also too?
With regard to this tool, this is something we're actually innovating to try to help have better tools to talk about it specifically. Across the country, we were just I'm a part of Alamo Angels as well. We presented at a conference of angels across the community around how do we better impact with our investment dollars, the social determinants of health. And so there were stories across the entire country that were having impact. One of the, gaps of performance was this purposeful measurement towards a specific goal. A lot of companies were doing good, and they could say, hey, we're doing good, but how were they measuring achieving an impact that is innovative? When a for-profit, we look at certain measures like, profit. Are we doing well? And that's important for these because they need to be self-sustainable. But in addition to that, and almost as much important, what are they doing to impact? What is that measure? And so that's a big gap. That's one of the reasons this tool is to start having conversations at the innovation stage around measuring that.
Hold on. Let me get Are there any plans to come into the RGV? I mean, I know that you're in South Texas, but like with your Apex accelerators, due to the fact that we're so close to the border, and I know that a few of my friends in the medical field, it seems that a lot of when it comes to product, they either go to Puerto Rico or other places and they feel that, you know, if there was one thing with the pandemic that showed it was hard to have product available in the United States. So is there anything that you guys are planning down here in the RGV, you know, having being so close to the border?
Well, I'll keep going with it. The reason for being down here, like even today, is, you know, from a community standpoint, the innovations typically come from the communities that are moving themselves, that can see the problems. And so things like this education to make sure, are we enabling and empowering the visionaries that have innovations and need the tools they need to start trying to create those innovations. The accelerator, it's in San Antonio, the vision to move it so that it impacts all of South Texas, absolutely. I don't know if there's any certain plans of that, but it's to help our community, which is South Texas, San Antonio, the Rio Grande Valley, Corpus, all these rural areas that, you know, are experiencing things that are, you know, every single day problems that, again, there's got to be somebody sitting around that goes, if I could just tell, you know what, I know how to solve this problem. You just give me this, I will solve it tomorrow. But they have no way to actually have a voice. They have no way to be supported. So this is the beginning of trying to impact the Valley for sure.
So just to add on to that, sorry, Maddie, if I can interfere. So we are working in partnership with Velocity and, you know, this whole concept to really bring that awareness here to the Rio Grande Valley through, you know, probably, you know, our center at UTRGV. One of the things that we want to do is eventually, you know, bring this accelerator capacity down here through these partnerships and be able to solidify what we call the South Texas Triangle. You know, which is very important that, you know, it's all over here, including, you know, beyond our borders.
Thank you. My name is Gladys Maestre. I'm the director of the Alzheimer's Center at the UTRGV.
Nice to meet you.
And nice to meet you. Thank you for your presentation and all the speakers and for the center for organizing this event. I really enjoy one particular slide that says life and then health. Because when we are talking about Alzheimer's disease, we are talking about the whole life. So I appreciate very much that. And the other thing I really would like you to expand is the relationship of the synergistic opportunity of community engagement. Because when we talk about innovation, sometimes we just think about a person thinking, but when we are talking about social determinants of health, it's beyond the context. It's about the collective effort. So could you expand on the role of community engagement in innovation, please?
Sure. From an innovative standpoint, you know, a lot of these focus really can focus on one life, right? But impacting them. But usually that life and many of the innovations we see are impacting a lot of people, and usually in a lot of, you know, in a community. Think clean water. Clean water is something that we just take for granted, but there are parts of the communities that don't have that basic. So is there a way to focus on getting that clean for that one person, but actually for the entire community? Things like medical access. We talk about medical care and medical access, but there are some other technologies where, you know, in Alpine, Texas, can they get the blood that they need in for that one life? How can we help that? So there's a lot of innovations for this part that are, I will say, focus a lot on individuals, but they have universal problems that go across entire communities and across the entire state. With regard to community engagement, I think there is a lot of talk about community engagement as a whole and sometimes missing the individual, which actually has more of an impact as well. So it's one of those I don't have a good answer for. But our innovations, again, take one, and how many of that one have the similar, what the market is for trying to address that. By addressing that one in that market, that's how we think we'll start to incrementally change lives through these different innovations out there. Engaging the community, Methodist Healthcare Ministries as a community engagement, as an enabler of nonprofits, of medical care within the region is fantastic to do that. I think this is slightly different, but also can lead to a better impact in combination with that. I'm not sure if that answered the question, but okay.
Just a small idea here. Just looking at the business model canvas, I think in this specific mission, it could be modified a little bit.
Sure.
Because we're having, some of the issues are healthcare related and some are not. Some are wellness related and some are more like civilian per se. Whenever we go into the healthcare, we need to know if the solution is going to be FDA regulated. Probably that could be a checkbox there, or who's going to pay for it. Because whenever we get into healthcare, we have payers, we have providers, we have subscribers, prescribers. So if we're going to use a tool to help an entrepreneur to analyze the business model in a whole, and especially since we have some that fall into healthcare and some in wellness, I think we should have like that, at least so they can have an idea of, I'm gonna have to go through FDA, I'm gonna have to have a prescriber, I'm gonna have to have someone else paying for it, and for that, they need to have a reason to pay for it, right? Like if we're talking about insurance, for example, I think it could be a good idea to expand it a little bit, just so they can have a better understanding of what they're doing.
Yeah, it's interesting now that you say that in that context, because what you're really talking about is there any sort of external barriers that you need to know about, right? Because FDA approval, is something that, some people, don't have to go through.
Yeah.
A device certainly does, and that changes their cost structure as well.
Yeah.
So I think that's a great idea to put that, also from a revenue stream, who's paying for it? I mean, a lot of times, for, companies, even companies we're talking to right now, they don't even have the ability to get reimbursement. So how are they actually funding that pilot? And so those are challenges, right? Yes. I mean, sometimes you got to work for free and do it for free until you can actually get paid for it. But I think that's a great idea. We're going to take that as a cycle to put on a barriers, potential external barriers part of that, because you're right, that is something that a lot of people.
Yeah, and who's going to be the prescriber and why they want to prescribe it, right? Like
Sure.
You have to have a doctor that is going to write a prescription, but they're good with their current solution. So that's why I think it needs to be there.
No, that's a good idea. Thank you
you.
for that suggestion.
So in my past life, I was a city planner for Brownsville. And,
Okay.
So I come at it from, I know you guys are trying to do this, but I had experience with change and social determinants of health and building trails and building sidewalks and literally physical change in the community. And one of the things that I think we need to work on is really, there was always pushback, always, constantly being, pushback. So when you talk about innovation within a community sphere, within city, within physical changes, I always ask the question, like, if we wanted to invest in a park, people would say, well, why are you investing on a park? Why don't you fix my streets? Mm-hmm. Right? So how do you bring that, how do you change that mentality to say, you know what, I prefer a better park and I'll accept a pothole, right? Because that's really, it all really drives down to that. And from the political level, a lot of politicians never hear, I can almost guarantee you, almost never hear the fact that, hey, can you improve my park, right? But anyways, that's where I come at it from is building that change that says I want that, right? But anyways, that might not be part of this, but I just wanted to put that out there.
Well, I thought you had like looked at my LinkedIn profile and saw that I was a city councilman in shirts, and I'm like, oh, this seems like something that we dealt with on a daily basis for that. Randy?
Yeah, I think right on track. But I think one of the things is to recognize is we come in here and we're already looking for solutions where we're still asking the questions. And so I think at the beginning of this, one of the things to recognize that, you know, an ideal thing would we would be here till tonight and we would have all over the wall all the questions that we think have some impact on social determinants. And then we would start to say which are the ones can we work on. So yeah, to get to your pothole issue versus the park is going to take a collective agreement with most in the community that that's the right priority, right? So to tell them doesn't work.
Thank you so much. If you don't mind me adding to that, I think one of the things that Methodist Healthcare Ministries has realized is that, and Matt spoke to this when he was talking about the ideate and research component, is when you're working on community engagement, when you're working on transforming communities, it's really important to hear from as many people as possible. And it may be that although you see the need for the park, that first, in order to work with community to gain trust, that you first do have to fix the pothole. And then you continue on. And one of the hardest things in healthcare is looking at assets and strengths. I'm a nurse. I went to nursing school 200 years ago, and we're taught a deficit and a need model. What are the needs? What are the gaps? What are the deficits? And when you want to change community, when you want to innovate and transform, you have to start with the strengths and the assets and build from there. And sometimes that means listening to community voice and starting in a place that maybe doesn't make sense to the problem, but it builds on the strengths, and then you build from there. We have a Wesley nurse in San Antonio who met a lady at a food pantry, and they got to speaking, and this lady wanted a street light. And so the Wesley nurse walked her through the process of getting the street light, and it got put right across the street from her home. And then Senora de la Vega said, now I want a park. And we're laughing. There are plans. So it starts with building on those assets and bringing the community together, hearing that collective voice. And yes, maybe you don't start here, you start here, but it gets you to that point.
And I'll just add one more thing from an innovation is, like you heard, the voice, right? That's why taking the time to get your idea validated by, is there really a problem, researching that to make sure, because I could have a great idea, but there's not a market or a problem for that, and I could have a really great idea, but nobody wants to put money towards it, right? At which point in time, it's a waste of resources. It's a waste of my time, it's a waste of others at that time. File it away like Da Vinci, and maybe one day you can build the contraption. But the validation and the voice, that I think that's probably the anecdote there that just says that's the way to make sure.
Before I get to more questions, there's a question online.
Oh, wow.
How does community-based participatory research fit into innovation in relation to addressing social determinants of health?
Wow.
There you go.
Randy? I mean, for us, we're not focusing on device. We're not focusing on pharma, which, of course, that is research, driven. But, from even just a medical access, there's a company that we've had talks with. I also am the principal of Duke Capital, so we're investing in companies that have impact in the social determinants of health. So I'll use an example of this company that we're talking to, and they have a device that's a spectrometer that will measure the outside air and also can predict COPD attacks and child asthma that's out there. There's lots of research that went in there to the spectrometer and the need and all those sort of things. So it can have a definite play. I think that comes back to, again, validating that idea, the research of the problem and your solutions. Research organizations produce a ton of innovations. I mean, an absolute ton of innovations. My suggestion is if it has that, as opposed to it can impact the community, a purposeful look at how well we measure it will directly impact the community, to take some of these innovations and really fine tune them towards, changing the social determinants of health.
Omar Oropesa with the Alzheimer's Center also. I have a question regarding your lean canvas. Is there a direction of that process comparing to the lean manufacturing cycle? And does the community factors give any source of direction?
For the lean, I'm sorry.
The lean canvas.
Oh, the lean canvas. What we use this for, so if we take this in a non-social determinants of health standpoint, which, hold on, let me get there. There we go. When it comes to ideation camps, which I think there's plans to have a startup weekend where we really focus on this, getting the ideation as a lean process, the validation of that, and iterative cycles that come back to your cost structure is not right, this box is right, but we need to do that. So there is some agility that comes to that. From a lean standpoint, what you do with this and moving that forward, I've seen some that run agile processes that are very, very lean. I've also seen people that just get it going. It depends what your problem is, what your solution is. There's better tools that I think in education with regard to lean and agility. That's something also that needs to empower those that are going to be innovators as well. It's a gap. We've seen it a lot in healthcare. In the last decade, the impact of lean processes on the actual delivery of care has been amazing. I mean, I think even Methodist Healthcare Ministries, like, y'all have a black belt courses now, don't you? Which a decade ago, nobody knew what black belt was. They thought that was where the kid went to karate. So I think you'll see that more and more in the innovation. It is a gap that's needed.
Sure. Douglas Best. Just circling back a little bit to the city council and city management. I was a city councilman in Pleasanton, Texas, and one of the first things we did was develop a master plan where we were very inclusive of everyone in the community. No idea was a bad idea. Everything got recorded. Maybe their idea wasn't today, we couldn't deal with it today, but we made sure that we looked at it, we respected everyone, and we put it within a planned structure. Over that period of time of 6 years, we renovated parks that hadn't been renovated since the 60s, put $3 million within the parks, built a new fire station, built in water lines that extended from the city down Farm Road, which is the gift that gives for 40 years. Extended the runway 1,000 feet so jets could land. It was focused on business-friendly processes. So there's ways to do that, but you have to be very inclusive and respectful of the community to make that occur. Also, even locally, to give you an example, if you remember the movie Space Jam, Michael Jordan, I'm also a nurse. And I was taking care of a child here in Brownsville who wanted to go see that movie at Christmas, but couldn't go. And he was handicapped, he was at home, he was on a ventilator, couldn't go to the movies. At that time, it was all about out of sight, out of mind. Special needs kids, you just didn't see them, okay? For many, it was an embarrassment. So I said, well, let me see what I could do. We went and we found the money, and we took 40 children to the movies at Christmas that year. That project has repeated itself every year in Brownsville. We missed 2 years for COVID. Even when I was up in Pleasanton, we came back for it. And you have several nonprofit groups now that it's their baby, and that's part of the secret sauce, is you get multiple people involved that this becomes their baby, okay? And last December, we took 2,127 special needs kids from Brownsville, Port Isabel, Rio Hondo, and Los Fresnos in over 100 buses to the movies here, all at the same time. Now, that doesn't happen because of me. It happens because of you coming together. And that's, I think, kind of the ideation here of what we're talking about. Somebody starts something, we jump on board, and we just run with it, okay? And just kind of giving a little example of how it's worked elsewhere, but also how things have worked here also.
Thank you for
Thank you.
sharing.
Any more questions? Takeaways? Well, in terms of us here, we invite you all to be part of the conversation. This is one of a couple of series, educational series that will be running out of eBridge and hosted by our center at UTRGV, to be able to continue the conversation, to be able to allow our partners at Velocity and Methodist to, invite you all to provide that kind of solutions, to be innovative about. We are, here at eBridge, we really want to make sure that we inspire all of you. And at UTRGV, that's what we do. We want to inspire the world. So we invite you to come back and invite others to continue. And if you have a solution, you can reach out to us or reach out to them, and we will be that filter for you here in the Rio Grande Valley. Why not? Let's change the world. Let's make this a better place for our community, for our people, for our neighbors across the border. There's a lot of work to do, and we can do it together. So thank you, Randy. Thank you, Derek. Thank you, Matt, for being here, for allowing us to be part of this conversation and this project. We are immensely proud to be partnering with you and hosting you here today, and we will continue to do that moving forward. And on behalf of UTRGV, we thank you for coming in today and listening to us, and everybody that's online as well.